So I'm going to get us started with a brief intro. My name, for those of you who are just joining us, is Stephanie Winters. I am the Executive Director of the American Academy of Pediatrics Vermont chapter. And that just means that I get to represent and work with a really amazing group of people who care about kids, our adolescents, our children, and our families. So I have the greatest job in the world, and I'm really excited to be with you tonight to have our first forum, or our parent and family night, to really talk about the COVID vaccine in our adolescent population now that it's open and our kids and children are being vaccinated. Today, I've seen lots of pictures and photos of happy kids and happy parents because their adolescents are being vaccinated and being protected. So I just want to welcome everybody. Thank you all for coming to listen in and ask questions. This is really what we want to do, is present you with factual information and then open it up and really allow you to ask questions that you have so you can make informed choices and decisions for your family. So with that, I would like to welcome Dr. Leah Costello and Dr. Elizabeth Hunt, who are both pediatricians at Timberlane Pediatrics, and they're going to lead the presentation tonight, and we'll be joined by video from the American Academy of Pediatrics Vermont chapter president, Dr. Becca Bell. So with that, I'm going to hand it over to Dr. Costello, and I thank you all for being here.
Hi, thanks for coming. I'm Leah Costello. I have some prepared slides. We'll probably move through them pretty quickly so we can have plenty of time for Dr. Bell's video and your questions. So as we all know, so this is our objectives for tonight, but just reviewed that. As we all know, as we've vaccinated more adults in Vermont and across the nation, we are seeing more cases amongst adolescents. So the two bars on the left represent children, and these are cases in Vermont as of yesterday. So the 0 to 9 and then 10 to 19, and you can really see that the 10 to 19 group is the second highest group of cases by age in Vermont. So clearly we need to work on reducing those cases, and vaccines will help. This slide talks about the number of cases among school-age children. The orange is school-age children, the gray is the rest of the population. You can see it peaked pretty much early April, late March, and has been declining, which is fantastic. And then this graph really represents the same thing, middle school, high school, and elementary school. The high school cases being in green and middle school in purple, clearly coming down, but also had significant burden of disease just a few weeks ago. So it's not only burden of disease that adolescents are getting COVID, it's also all the other things that are going on with COVID, that just the burden of life right now around COVID. And this is a great quote that I actually, let me just change the video. I can't read it because I have pictures in front of it and I can't.
I can read it.
Oh, awesome.
So this is from a student who speaks really honestly and says, "We have Zoom, Google Meet, FaceTime, and every other form of video service at our fingertips, but we don't have a true connection. There is no replacement for the smiles in the hallway, the feeling of winning playoff games, and the satisfaction of knowing the correct answer. We want to be kids, but the pandemic has forced us to grow. We are still young, but we feel so aged by all we have been dealt. We want to cry about all we're missing, as we're still just kids trying to cope, but we also know that we are grateful for our health and safety. We feel guilty, relieved, and completely terrified. We're big kids, we can handle the truth, but we also want our loved ones to hold us tight and tell us it will be all right. We miss our lives. We miss just being kids." Wow, what an amazingly articulate and open and honest, wonderful young person. Catherine Luton, thank you.
Yeah, that was great. So we know that there are other effects of COVID on kids, not just the disease itself. Our president of the Vermont AAP chapter put together this fantastic video. She's a friend of both of ours and a very well-spoken
Hi there,
woman.
I'm Becca Bell. I'm a pediatrician in Burlington and the current president of the Vermont chapter of the American Academy of Pediatrics. And I'm just going to take a few moments to talk about how excited we are as pediatricians that the COVID-19 vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured. And so vaccines are something that have always been really important to me because they help prevent a lot of the very serious illness I sometimes see in the ICU when children are too young or haven't been vaccinated against a vaccine preventable infection. And when I think back to last spring when everything was shutting down and I was working with some of my other ICU colleagues who care for adults, and we were really worried about the number of ventilators and the number of hospital beds. If you had told me then a year ago that we would have a number of safe and effective vaccines that in trials when tested on tens of thousands of people, prevented people from not just dying, but even becoming seriously ill enough to even be in the hospital, I don't know if I would have believed it. It's amazing how effective these vaccines are. And a lot of people are wondering, how were we able to get these vaccines so quickly? It seems like quite a feat. And, you know, in pediatrics, we're used to vaccines taking a little bit longer. And part of that is that there's a lot of competing interests in terms of what type of research and technology gets funded, right? Lots of competing interests there. And when we test vaccines on other types of infections, usually those infections aren't as common, aren't as prevalent. And so it takes a while to get all that data. But with COVID-19, as we all know, the world stopped last spring, just completely stopped. And the biggest priority that everyone had in the world was stopping this virus. And that what that meant really was having safe and effective vaccines. That became the top priority. And so every effort was turned towards that. All this funding was turned towards that. And a ton of collaboration happened in order to make this possible. So I want to talk a little bit about the vaccines that you all qualify for, are eligible for, or will be soon, and that's the messenger RNA vaccine. So that's the Pfizer and Moderna vaccines. So this is a technology that's been in use in cancer therapies, and also scientists have been using it to study vaccines for other infections. And so when the world was told what the SARS-CoV-2 virus looked like, that was something that was shared with everyone, people got to work. And so they used this technology that already existed, and they made it applicable to the SARS-CoV-2 virus. And because there was so much funding going towards this, they were able to make this happen on a little bit of a quicker timeline than usual, but all the steps were there. They went through every single step. And because COVID-19 is so prevalent, when they did the efficacy trials to see if it worked, and they gave vaccine to some people and a placebo to other people, they saw very quickly that the people who received the vaccine weren't getting sick from COVID-19. And the people who didn't receive it were getting sick. And that data was collected so quickly that they were able to get a pretty definitive answer that these vaccines are really effective. And one thing that I think is so interesting about the mRNA vaccine is that it really gives your body instructions for how to make a protein that looks like what's on the virus. So what do I mean by that? So when you get the vaccine, this mRNA is like a little piece of instruction, or I almost think about it like a handwritten recipe that's sort of passed down in your family, right? You have a piece of paper with a recipe, and then these are instructions. And your cells can make, based on the instructions, can make a spike protein with that. Then once it's made, recipe goes away, and the mRNA, it just kind of disintegrates and disappears. And then what you have is this harmless spike protein that's not the virus, but is similar enough that your immune system can look at it, recognize it, and get ready for it in case they ever see the SARS-CoV-2 virus. And this is really important because this is what will stop the virus from replicating throughout your body if you're exposed to SARS-CoV-2 and making you very sick. And one of the things we know in intensive care medicine is that these viruses, SARS-CoV-2 in particular, the virus itself can cause a problem in your body. It can cause direct injury and illness. But the other problem is on the other end, when your immune system is trying to fight off that virus, that battle that happens can create a ton of inflammation and a lot of problems and a lot of illness. So it's that back and forth between it's the virus and your immune system. When you get exposed to the virus, when you get sick, that can make you really sick. Now, in someone who's been vaccinated, instead, their body sees the virus and their immune system's already ready. They already have the antibodies. They recognize it really quickly before the virus can kind of get out of hand. And they've got the cells ready that they know they need to fight off this virus. And that's why people aren't getting very sick. They're not dying. And if anything, they might have a mild cold after being vaccinated. And that is what's so amazing, is that these vaccines give your cells this recipe for how to create this spike protein. Your body then, your immune system then learns it, understands it, recognizes it, and gets ready for it. So when the first authorization happened, first with Pfizer in December, I was one of the lucky ones to get vaccinated pretty early. And as you can imagine, there were lines of doctors and nurses and other healthcare providers who were just so excited to get this vaccine. I mean, it was emotional. I felt emotional getting the vaccine for the first time, knowing that I was protecting my body. And then I got my second shot in January and had the expected, many people kind of feel crummy the next day because they have that, they can sense their immune system sort of recognizing again this spike protein and sort of revving up for it. And then felt fine after a day. And it's just been so amazing seeing my rest of my family and my friends and my colleagues and everyone I love getting vaccinated. My own children are too young right now. They don't qualify, but I am going to be so relieved and so grateful when the vaccines are approved for their age group, and they will be first in line. So I just wanted to spend a moment just to really let everyone know that, we're living in this really, really challenging time. This virus has really wreaked havoc directly and indirectly, and it's affected all of us. But there is this really bright spot, and that is these vaccines they're really effective, and they're really doing what we want them to do, which is to keep us from getting sick. And we really want you to ask questions. If you have questions about the vaccine, we're here for you. Pediatricians are really excited that the people we love, our patients, are going to get vaccinated soon. And we're happy to walk you and your family through this process and work towards getting our communities healthy and getting back to doing all the stuff that we love doing. So thank you so much for listening, and please feel free to reach out to your pediatrician and reach out to us, and we're happy to work with you on this. Take care.
I thought that just was really well done. Dr. Bell is a fantastic public speaker. One of the points that really stuck out to me in that video was talking about how despite this coming to fruition within, a year and a half or a little less than that this vaccine, we still took all the steps that needed to be taken. And we were able to do that because the burden of disease was so high. There was so much COVID-19 in our communities where the studies were done that they could see that there was an obvious difference between those who were receiving the placebo and those who were receiving the vaccine. When we study other vaccines like HPV, which was one of the more recent vaccines that came out well over a decade ago, there was not a high burden of disease. So it took a long time to study that, to see enough of an efficacy from the vaccine. And so that's why, despite this feeling fast, it actually went through every single step and showed efficacy so quickly because of how much COVID is around. Elizabeth, anything that stuck out to you?
So the groups that started this wonderful work will be followed for years after. This, like I said, is part of Operation Warp Speed. Dr. Bell alluded to how quickly it's happened, but it's happened quickly without shortcuts. And many parents have been asking me, it all feels so soon. How do we know what the long-term effects are from the vaccine? Well, it's hard. We don't know the long-term effects of COVID beyond the long haulers of all ages. Now over a year from the first cases in the United States, but these studies do follow vaccinated individuals for quite some time. I think it's 2 years for the adolescent study. And as things come up, just like we saw with the J&J one-dose vaccine, the scientists and the regulating bodies are all over anything that comes up quickly and really intelligent about looking at all of the information. So I just thought that might be helpful for some people with those concerns.
We have a little bit more here on, now I can't seem to advance. Oh, there we go, sorry. So why vaccinate our teens? Sorry, this is a large file and it's being just slow. I'm gonna try again here. Here we go. These are a few slides from other American Academy of Pediatrics chapters across the state about why teens need the vaccine. So the one on the left is really getting to us as parents, like, don't you want your teen back in school, sick and tired of having to be quarantined and everybody staying home? Yeah, schedule your vaccine. But then also for the kids to think about too. Again, also for them, no quarantine, freedom, seeing friends, able to socialize, living a much more normal life with the help of this vaccine technology. As a parent, you're probably getting a lot of questions about this. So we've been doing vaccines for ages 16 and above since December, and now as of this week, vaccines for 12 and up. The vaccines work very similarly to other vaccines that your child has received. They prime the immune system to be prepared for COVID to enter the body and be able to mount an immune response more quickly, therefore either causing no disease or much less symptomatic case of COVID. So there's 3 different vaccines currently that are approved. The only one for children ages 12 to 18 is the Pfizer dose. It is an mRNA technology vaccine. Moderna is also mRNA technology, and then the Johnson & Johnson vaccine is a viral vector technology. Dr. Hunt and Dr. Bell talked about the Johnson & Johnson vaccine and the pause that was recently taken, that we now feel like the potential benefits of that vaccine outweigh any risk in individuals 18 years and over. Statements have come out from adult medicine and obstetric and gynecology organizations saying they really stand behind that recommendation as well, too, that the chance of developing that rare clotting disorder is extraordinarily low. Again, this isn't available for 12 to 18-year-olds. The vaccines are really effective. It's been amazing. They are 100% effective at preventing serious disease and death. There's not a lot of things that we can say are 100%. And that's really what they're seeing with these vaccines, and it's pretty incredible. We unfortunately don't know at this point how long immunity will protect people. But no one's called me back, and I got mine in December, so I think it's still working. And then this slide asks to the question of, is one vaccine better than the other? Again, your team is only eligible for one. Really, none are better, but it's so great we have choices, and that if you feel uncomfortable about the recent pause in the Johnson & Johnson vaccine, you here in Vermont really have the option to get any of the 3 vaccines that feel right for your family if you're over the age of 18. What we know right now about the COVID-19 vaccine for youth is that they seem to be remarkably safe and effective. Trials have been, the trial for kids ages 12 to 15 included 2,000 people, but the trials for all of the vaccines, including the AstraZeneca vaccine as well, have included tens of thousands of people. We've been giving millions of shots have been administered between December and now, and we had no safety signals or alerts saying that there would be any cause for concern in ages 16 to 18 or in adults. And we're monitoring this closely. By we, I mean the CDC, not me and Elizabeth. But we are but this is being monitored so closely to the point that we can pick out something like 7 to 10 cases of a clotting disorder among almost 7 million doses of the Johnson & Johnson vaccine being given. So these vaccines will be monitored quite well for safety. What do we know about side effects? If you actually look at the data, it's really similar to exactly what they're seeing in adults. The numbers are almost identical. So many having very limited side effects after their first vaccine, and then after their second vaccine reporting some fevers, chills, headaches, fatigue, muscle aches, and then obviously pain in the arm. These are temporary. They usually go away within the day. We can all get back to our normal life. It takes about 2 weeks after getting the second vaccine to have full immunity. And these vaccines are free, even if you do not have health insurance. This slide talks about clinical trials are ongoing actually right now for kids to as young as 6 months, and we hope to have some data for 2 and up in the fall, according to Pfizer. And then probably over the last couple of weeks, you heard that there was some concern about timing on vaccines, that we couldn't give other vaccines if your child was going to get the COVID vaccine. That was really out of an abundance of caution. The Advisory Committee on Immunization Practices, ACIP, and the CDC met on Wednesday and feel like that actually is not a necessary recommendation. So your child can still go ahead and get other vaccines that they need, because we all know kids are going to camp and have required vaccines, and we want our kids to get all of the other vaccines that we recommend as pediatricians. These you can register at Kinney's, Walgreens, CVS, the health department. All those places are options for registering for vaccines. And then some school located clinics. So Elizabeth Hunt and I live in the CVSD district, and we're having a large vaccine clinic on Tuesday. I believe there's almost 1,000 doses, which is very exciting, held at CVU. And it is open to the public, I believe. I'm not sure actually how to sign up, but it's big and it's very exciting. So, the kids do need consent. That will be on, the pharmacies will have their own consent form. The health department will allow consent with, you can, I think, fill out a form on the health department website giving consent for your child. So these are a few other resources. Healthychildren.org, Vermont's Department of Health webpage, and the CDC all have great information for families. And now questions. And I'm going to stop screen sharing so that we can see folks. But I can't do my mouse.
Great.
I'll try it in a minute.
Thank you. Yeah, thank you so much. You guys did a great job. And I'm going to read through, there's a lot of questions. Some of them have been answered, but I'm still going to read through and read the answers just so everybody can hear them, even if they're not following the chat, and also for our interpreter to be able to read the questions. So I'm going to start at the top. I have a child with a lot of allergies and had a past diagnosis of neuroinflammatory condition. Can they get the vaccine with limited risk of a negative side effect?
Yes.
So I think that's fine based on what we know about, how most vaccines work and the published contraindications, which are reasons not to get the vaccine, are very specific. And this vaccine doesn't have latex. This vaccine doesn't contain egg products. This vaccine is very low in allergenicity. And if you haven't had certain, I think, biologic medicines, there are certain very unusual medications that if you react to those, you shouldn't get this vaccine. Dr. Raska, maybe you can help me out. But in terms of being like a sensitive patient who maybe has GI or other sensitivities, allergies, and the neuroinflammatory piece is important. But to our knowledge, pretty much all comers can get this with those kinds of underlying issues.
You are correct that there is no contraindication and there's no precaution even.
And for those of you who do not know Dr. Raska, Dr. Raska is a pediatric infectious disease specialist and has been our expert on the fly at every meeting and every turn with all of the pediatricians in the state. So he is our homegrown expert. Thank you.
I think that allergy concern is an important concern because we are all hearing that you wait 15 minutes after your vaccine. And so kids will be the exact same.
You're getting a little low, Leah, your volume.
Kids will be watched for 15 minutes like everybody else after the vaccine. They will be, it'll be done in an area where somebody could respond to them if there was an allergic reaction. But on review of the FDA paperwork, there actually were no anaphylactic reactions in children during the study period. So interesting. But certainly something to, have your child be monitored after.
Great. And this next question is a little bit along, go ahead, Elizabeth.
The other piece, I think so much of what we're talking about has already been observed and discussed in the adult population, like the underlying conditions, right? And so we've been vaccinating adults since November, and so haven't seen the problems. We've seen great efficacy, like Dr. Costello said, they didn't see any allergic reactions in the study sample, which was about 2,300 adolescents from 12 to 15 years old. And in that group, they saw no COVID also, which was great, which was what Dr. Bell was talking about in terms of the speed. When something is tested long enough and it works, then the forward momentum of making it safely available to a population is the next logical step. So I hope that helps.
Great. And kind of related to that, are there greater risks for kids with asthma in getting vaccinated?
No, there are not. So again, and the same, with adults that have vaccinating millions of adults and millions of teens, 16 to 18, who all would have the same, risk of asthma. We really have not seen any safety signals around that condition. So we can safely say that there's no contraindication with a child with asthma.
Are the side effects of vaccination for children likely to follow the same course of side effects that their parents had?
Most definitely. Actually, I have the percentages here, and many adults or older adolescents, 16, 17, and 18-year-olds were a little bit tired or maybe just not on their game for about a day. But many adults did feel aches, perhaps some fatigue. I was a little nauseous and just tired. I went to bed early, but just the very next day, like Dr. Bell alluded to, I felt fine. So the Pfizer study quotes pain at the injection site and about 84%, which all of you kids on the phone know happens with your vaccines, your standard vaccines. Fatigue was 63%, headache 55%, muscle pain 38%, chills 31%, joint pain 23%, fever 14%, and then swelling at the injection site, which is evidence of an immune response, not an allergy, was in 10%. Nausea 1%, and lymphadenopathy, which is swollen glands, in less than 1%.
We solicited some questions from kids at Charlotte Community School, and one of them was about the SBAC testing that I think is happening this week, and concerns for side effects after receiving the vaccine. Most people, similar to adults, tend to do pretty well after their first vaccine and then have a little more of a response after their second vaccine. So the second vaccine would be much closer to the very end of school. I assume testing is done at that point.
The next question is, are there any issues with the volume of the vaccine dose for smaller children, such as those under 70 pounds?
I like to compare this to the flu vaccine. We actually use the same dose of the flu vaccine for all ages. So it's not the same one for a 5-year-old as for a 15-year-old. We have to remember, yes, we dose our medications weight-based. This is not a medication. This is totally different. This is promoting an antigen response that we feel that it is safe, as with the flu vaccine, to give the same dose to your 70-pound 12-year-old and your 200-pound 18-year-old. So.
Great. And then there's a question, and 2 of our physicians have answered it. So I'm going to read the question and then read their answers. Is there an impact to children who are 12 and yet to enter puberty? And Dr. Hunt answered, not that we know of. The 12 to 15-year-old group has almost the exact same profile of side effects and efficacy. And Dr. Raska answered, no, to the best of our knowledge. However, they did not specifically assess sexual maturity rating. However, younger children did just as well. Anything to add on that?
To that is that we really have no reason to feel that there would be any effects on puberty. It just, regarding the technology, does not raise a concern. The same way that this doesn't raise a concern in the obstetrics world about giving this to pregnant women and the effects on the fetus. So that there's just not, the science behind it does not support any effects on puberty or fertility or fetal development.
With more and more people becoming vaccinated and today's announcement that vaccinated individuals can go maskless indoors, how do we safely protect our children who are not old enough to be vaccinated? And I will say that I did see an answer. Dr. Hunt answered standard guidance and mask the younger children when indoors or in crowded settings. stay home when you're sick, keep physically distanced, keep in touch with your medical home. Great answer. So here's how come the vaccine is available at pharmacies while normally they are offered only via a primary care physician? I think it's great, by the way, that they're offered so quickly this way. And thanks for doing this, Liz and Leah. I mean, I can take a little bit of this just from the back end.
You probably know the back end to this a little better than we do. So
yeah, just from an operational standpoint, trying to get so many vaccines out and to people is really a big undertaking operationally. And because of the storage, the Pfizer vaccine had to be at ultra cold storage. Lots of primary care offices do not have that kind of storage capability. The size in which you had to order some of these vaccines was so huge, and the offices would not be able to use them in time before they were spoiled. And so if you couple all of those things together, it just wasn't the right time to put it into primary care offices. What I will say is they're going to start piloting that next week, and they're actually changing and relaxing some of the guidelines around how these vaccines have to be stored, how long they can be stored at a certain temperature, and being able to order them in smaller quantities, which will make it a lot easier for primary care offices to have them and to give them to their patients. So we're slowly getting into that as we transition from these mass vaccine clinics and start to do them on a smaller scale within the medical home. And Dr. Hunt had answered, storage and handling are big drivers, which is very true. And Dr. Raska also answered that question. I've heard of instances in which after having the vaccine, women have experienced a lapse in their period up to several months. How can we be reassured that there are no long-term effects of the vaccine on our young children's ability to reproduce years later?
I'll take that one from kind of a general standpoint. Dr. Raska pointed out to Nancy Wood here that menses, menstrual patterns weren't specifically monitored. And, some young women are more sensitive than others to illness, moving, stress. And so menstrual periods can be a little wacky when you're 12, 13, 14, and 15. But wacky menstrual periods usually don't mean you're not going to be able to conceive and become a mom when you're older. We don't see that. And generally speaking, I think it's good to look at vaccines for our children and the individual benefit and the individual risk over the decades. Like, there's so many hypothetical risks to kind of think about or read about, like that get put out there, perhaps in Europe by anti-vaccine folks who put out some, questions about fertility a few months ago, things like that. But if you look at the patterns, like there hasn't been an unsafe vaccine released by the FDA in our country in a really long time. And even some vaccines who were not optimal, like the HPV vaccine, needed to go through some changes to just be more efficacious. They got right on that, and they released a vaccine within, a couple years of the first one that had a lot more coverage and protection. I know people worry that vaccines are created by big pharmaceutical for-profit publicly traded companies, and that's where we come in. So we kind of filter that, doubt or just healthy cynicism that we Americans are known to have. And so hopefully this information, like the studies, the data are raw, they're in black and white. They're not guided by these big pharmaceutical companies. And these big pharmaceutical companies have been making great vaccines, meningococcal vaccines, flu vaccines. They're playing around with Zika vaccines still, dengue vaccines at UVM. I mean, The first vaccine was in the year 1000 AD for smallpox. It was just a little poke of a pock and a little transmission. And so over time, they've been shown to be very effective for the individual and for the population, and extremely low risk, extremely low risk. So that pattern with all of this potential unknown reassures me as a parent and as a pediatrician. And that's something to kind of stand on with your own 2 feet on. I don't know if Doctors Raska or Costello have anything else to add.
Elizabeth, that was lovely. I'm going to take some of that wording for my own, working with my own patients. Nancy, thank you for that question. I think a lot of people are talking about this. We actually also see some period irregularities following COVID. And I think we always have to bring this back to the disease that we're trying to prevent, and that we don't really know about the long-term effects of COVID. Probably not any effects on fertility or changes in pubertal development, but we're trying to prevent a disease that could have very long-term complications, very significantly cardiac complications. So I think bringing it back to that and your risk-benefit analysis around vaccines, and thinking about it too, that like asking these thoughtful questions is really important in making that decision for your family.
Great, and this question is very similar, and I think it would have the same answer, but I'm going to read it just because it was asked. I am thankful that there are vaccines available to help prevent COVID now. My husband and I are now vaccinated and feel relieved and more safe. My concern is that we do not know the long-term effects for the kids who are still growing and developing. Could this be harmful to them when they are ready to have children of their own? So I think we got into that, and I just wanted to read it because it came in.
One other piece to that question too, and that like thinking about the long-term effects, is that we actually really don't see long-term effects of vaccines. Like we've had vaccines around, we've been doing vaccines for decades and decades, and that really the effects of vaccines are within days to a few weeks after vaccines, not months, years later. That's just not the research that we've seen or information that we've seen coming out of vaccines. And as Dr. Bell talked about in her video, this is like a recipe that your body reads. The vaccine goes into your arm. It tells those cells right there in your arm that it went into to make this spike protein. And then the mRNA degrades. The vaccine totally degrades. And so there's just really no concern from our, the scientific community and folks that really study and study vaccines over their lifetime, really don't have concerns about long-term effects of vaccines.
Yes, and I like how Dr. Raska answered in the chat about, we don't know the long-term impact of COVID on fertility and a lot of things, and so we have to weigh those kinds of things against the serious effects of COVID, or not only serious effects but death. So that was a great question, and people thanking you all for this great information, that it was so helpful and will really guide people with informed decision making. And I'm at the end of the chat. If people have other questions, please feel free to chat them in, or I don't know if you guys want anyone to unmute if they wish. So definitely do that. And another thank you for your expert guidance.
I do just want to say, like, it's really normal and okay to be unnerved about new things and uncertain about what this means. And many of us are so excited about it. I know many kids in my neighborhood actually already signed up, but that's not for everybody. And that doesn't need to be you today running to sign up your child. Like, you're allowed to take some time and think about this and see how children do over the next few weeks, that's okay. But we just ask that you kind of be nimble and be open-minded and be willing to take your questions and your concerns to somebody who you trust, like your trusted pediatric provider, to talk about that for you, what's best for your family.
Great. Another question just came in. Oh, go ahead, Elizabeth.
Go ahead. Somebody was on video. I thought maybe she had a question, but go ahead, Stephanie.
Okay. Just another question about infertility, and this one asks about women, but also asks about men. So will this vaccine cause infertility in men?
I believe that, oh, go ahead.
I see a lot of no.
So far, amongst the millions and millions of men who have been infected with COVID, we have not seen a signal that men previously infected have had decreased fertility. There was one sort of odd report in sort of the lay literature about a sperm fragmentation index in the time after COVID or COVID vaccination. And the CDC is following that, but so far we're not seeing any signs that either the infection or the vaccination is leading to a decreased sperm count over time or decreased fertility in men.
Great.
I kind of wanted to address the flip side. So Dr. Costello is right. You need to make your own decision and feel good about it. And I did attend the commissioner's address, the health commissioner at lunch, and he used the words precipitous decline in cases, that it's really, we're seeing it. And we're seeing it because of vaccination. Many people are immune, partially immune from having had COVID, but we really don't know how long that lasts. I've had people ask, what's the big deal? I had it, or I'm pretty sure I had it last year. Like, I think for kids and the lost time that the brave young woman alluded to in the beginning, the flip side to me is the ability and the enablement and the strength and the bravery that vaccination leads you to. There are great guiding principles for fully vaccinated people. I mean, they include not having to miss work if you're exposed to COVID, not having to not having to quarantine when you travel out of state. My children are attending sleepaway camp, and I just found out that if they're vaccinated and they're exposed, they can stay. If they're not vaccinated, they're going to be sent home from camp, which would put a little wrinkle into my work week. And so the ability to like just relax and just be together and have doors open, have lights turn green is very tangible, and it's very palpable here for this population. And we don't want it to feel rushed to the parents out there, but we really don't want it to feel rushed or scary to the students. So if there are students on the call and you have questions, or you want to type something in, or you've wondered stuff, go ahead. I got some questions from some CCS students, and they were mostly about like school, masks, the SBAC, things like that. And the school, just so you know, the schools are going to be really, really looking out this summer to see what's going on with COVID and vaccination. And they'll make plans for next year, and they'll let you know. We'll be, there to work together. But I couldn't really answer those specific questions from the CCS group.
Yes, some of them won't be made for a while. Some of those decisions the kids had, the questions the kids had.
Yeah. We have a couple more questions that have come in. Any information or thoughts on reports of heart inflammation in young males from the mRNA in Israel?
I am not aware of that. I'm well aware of heart inflammation from COVID. So that's very much a side effect. Many of you probably have teens who have had COVID and have to come in for a cardiac clearance a couple of weeks after their positive test, even if they weren't ill, were still doing cardiac clearance because of COVID's effect on the myocardium, the muscle of the heart.
Great. What advice do you give to someone who says, I already had COVID, why should I get the vaccine?
It's kind of like the flu. You get the flu one year, you feel like absolute you know what, and you can get it the next year. You still get your flu vaccine in the fall, hopefully, so you don't get it for that season. So even if you've had something, this is not the kind of virus that we think is going to give you protection like kryptonite for the rest of your life. We think you need to really update your immune system to be ready for an exposure to COVID. And so having had it is important to know. But in many studies where they've looked at specific antibody titer, so the amount of antibody, people who both had COVID and then got vaccinated had awesome titers, like the highest in the group. And so it's a great opportunity to be very immune and protect yourself, protect those you love, protect your community. And it won't, we don't think from what we've seen so far, make the vaccination worse. People have been asking me about that. I don't know about you, Dr. Raska, if you've been getting those questions, but people have said, oh, my kid had COVID in December. I'm scared he's going to have like a lot of soreness or a lot of side effects from the vaccine. But from what I've read, that hasn't borne out.
To the best of our knowledge, if you've already been infected with COVID, that we're not seeing an increased signal for increased toxicity due to vaccination. What's really striking about the vaccine program is that it is actually probably inducing more durable and broader immune responsiveness than natural infection. That's a little bit different from how we're used to thinking about things, oftentimes with chickenpox and a variety of other things. But people after vaccination have been relatively resistant to the variants. People who had the natural infection have not been as resistant to the variants. So I highly recommend all people to get the vaccine whenever they're eligible for it.
Great. Have kids gotten headaches as a result of this vaccine?
Yes,
not terrible. I've seen like probably 20%, 10 more fatigue, achy, low-grade fever. Have you seen many headaches?
It was certainly reported in the data. I haven't had anybody, had a couple calls actually about fevers, but most of the teens I've chatted with that have gotten it over the last several months have done pretty well with it.
I think my child had it last year when it first started out. Should I be scared about her getting the vaccine?
No, I think Dr. Raska just covered that, but we really feel confident that it is okay for your child to get the vaccine.
Will folks need to get revaccinated? Do we have an estimate for how frequently, and are we still in the wait and see period?
As far as I know, we're still in the wait and see period. But
we are definitely in the wait and see period. That I will say that both Moderna and Pfizer have booster shots already planned and tested in adults and ready to go if we need them. But remember, we only have 6 months of data. So far, the vaccine seems to be holding up very well. They hold up extremely well against the dominant strains in the United States right now and seem to be working pretty well even against the things that were originally described in South America and Southern Africa. So that's encouraging. But if they fail, for their breakthrough cases, we will be ready. We just don't know the data yet.
Great, and I'm going to read, Dr. Raska touched on the report from Israel. While there have been several reports of cardiac inflammation in Israel in those vaccinated, we do not know how many people unvaccinated had cardiac inflammation. We see cardiac inflammation in the general population, and the Israeli CDC is following carefully, as is Pfizer. And then another question in regards to the headaches in kids, how long did they occur and were they worse in the second vaccine?
Most people complain about the side effects such as headaches and fevers for the 12 to 24 hours following the vaccine. And we do see more in the second doses for both Moderna and Pfizer. The actual data for Pfizer that Pfizer put out, I believe was actually headaches in about 70% of kids and about 50% of adults in their studies.
Great. Laurel Jacobs has her hand up. Would you like to unmute and ask your question?
Sure, thanks. I just wanted to follow up. I had asked a question earlier and I appreciate the answer. My question was specifically about with more and more people who have been vaccinated being able to remove masks at this time. Does that increase the risk for those who are not able to be vaccinated? So for instance, my husband and I are both vaccinated. My daughter is 12 and she'll be vaccinated on Sunday. I'm excited to say. But I have two 10-year-olds and it makes me concerned that if mask wearing, the intent of mask wearing was really to say not transmitting this as much and as frequently, even if those who are vaccinated are removing their masks, it's my understanding they can still transmit COVID. So does that increase the risk? And it just seems like maybe there's a vulnerability for children who are not capable of being vaccinated. Does that make sense?
I can start to help with this one because I think that is an important question. One piece, I heard that exciting information today, but I also am waiting until tomorrow's press conference to really see what our health department, because I think, all along the Vermont Department of Health has really been putting out guidance that matches the CDC, but also has clarifications that are really important for Vermont. Looking back to the slide, the very first slide in our presentation tonight, the burden of disease in younger kids in that 10 and under has been pretty low. So they do seem to have some just naturally protective factors or just a lower risk. So and their disease has really followed the community prevalence. I think Elizabeth could probably agree that we were seeing very little, if any, kids, in the summer and the fall. And we didn't start to see the younger age kids at more frequency until the burden of disease in our community went up significantly this winter. And now again, we're seeing that drop. So that kids, your children will, by having the rest of the community hopefully be vaccinated and have less burden of disease in the community, that your kids will have natural protection through that. And then that we can control things, that we know that all of the things we've been doing all year, the masking and distancing, outdoor events are really just the way to continue to provide protection to your younger children. And I have 3 younger children who don't qualify for the vaccine right now. I don't think we're going to be flying anytime soon, unfortunately. But hoping that as the community levels go down, that we can do more and more.
Great, thanks for that information.
Sorry about that. I have a couple more questions, and then I know we're nearing time, so I want to be mindful. One was, is it okay to give Tylenol post-vaccines?
Sure, we don't recommend giving Tylenol or acetaminophen or ibuprofen before vaccines because we want the immune response to be able to do its thing in real time with all the right cells. And so, but after, for soreness, for aches, fever, it's absolutely fine. A nice cool compress or ice pack can help. And the best thing is to rest. Like my son's getting his next week and I already figured out, if he just needs to lay around that next day, although hopefully he's not on the call. He can do that, rest. Your body loves rest. That's when you grow. For all you teenagers out there, you got to get enough sleep. But also, that's when your immune memory is like working, you know. So Tylenol is a good thing. It's totally fine.
Great. Not quite sure this question. How many 12 to 15-year-old patients have we had since last winter? Yeah, if you could either unmute or clarify your question. I'm wondering if you mean COVID patients, but
yes.
if you could
COVID.
clarify, that would be great.
Yes, I mean, how many COVID patients in that age group that we have had since last winter?
Hold on, Bay. I'm looking it up on the graph.
Well, you look,
Are you
Elizabeth, I
able
have
to
another
see my
question.
slide?
I think I know who this is, so I know how I can email you. But
Okay.
we have not had, I don't think, as many positive COVID patients in the age group as the study included, right? I mean, oh, thank you. There we go. Let's see.
But this is through the last 14 months.
Okay, well,
So that's about 3,600 in adolescents, 10 to 19, and 1,700 in younger kids.
What is the base population from that study?
the Pfizer study of 12.
Oh, and sorry, this is not the study. This is Vermonters.
Yeah, the Pfizer study was 2,300 children ages 12 to 15 that led to the release of the vaccine for that age.
Okay, just so I wonder, in our local community, how many Vermonters in that age group?
We don't have that level of granularity that there are age brackets. And presumably if you went back to the original reporting data, you could do that, but all state health departments bin data, meaning that they put it into large groups. And our state health department uses, 0 to 10, basically 10 to 18.
Okay, I see. Thank you.
Great. Well, we have one more question, and then I think we'll end for the evening. If your child is in between doses for another vaccine, for example, Gardasil dose 1 and 2, is it safe to get the Pfizer vaccine if it has been more than 2 weeks? How long should you wait after Pfizer dose 2 to receive a second dose of the other vaccine?
That guidance changed 24 hours ago. So things move quickly.
And there's a slide on that.
Yeah. But we now are getting guidance from the CDC and the Advisory Committee on Immunization Practices that we can safely give vaccines, the COVID vaccine, without any concerns for timing of other vaccines.
Great. Well, thank you all. Thank you for the amazing questions and the participation from everyone, and to our wonderful pediatricians who presented some really great information, and to our interpreter for helping us tonight make sure that everyone got the correct information. And if you have questions, I did include a link to a form. If you have other questions, you can certainly use that link. I also included a link to the school clinic list. So if you want to know if you're in a certain area and you want to know where they're being held, you can click on that and find them. So thank you so much, everyone, and I hope you have a wonderful evening.
Thank
Bye-bye.
you guys for coming. That was fun.
Yeah. Good night, everyone.
Stay healthy. Good night.